WHO's chief, Dr Tedros Ghebreyesus, has sought to set the record straight over allegations that his organization downplayed the COVID-19 outbreak in its initial phase. He accused individual states of disregarding WHO's public health emergency warning on January 30th. Listen in to what the Director General had to say.
Listen to WHO then carefully, because global emergency, the highest level of emergency, was triggered on January 30 when we only had 82 cases and no deaths in the rest of the world. And every country could have triggered all its public health measures possible.
The WHO chief said that he does not have the legal mandate to impose guidelines on countries. The WHO's role is advisory in nature and depends on compliance from governments. According to Tedros, countries that implemented the WHO's advice were able to stem the outbreak. But there are discrepancies in the WHO chief's defense. For example, the situation report for the day this public health emergency was declared makes no recommendations on international travel. It instead focuses on testing and contact tracing. But as it would later turn out, international travel should have been curbed much earlier. Most of the cases in US trace back to European travelers, the same here in India. Dr. Tedros also had a warning for the world community that the pandemic is far from over. The WHO hinted at possible outbreaks in Africa, Eastern Europe, and even Latin America.
As lockdowns in Europe is with declining numbers of new cases, we continue to urge countries to find, isolate, test and treat all cases and trace every contact to ensure these declining trends continue. But the pandemic is far from over. I repeat, the pandemic is far from over. WHO continues to be concerned about the increasing trends in Africa, Eastern Europe, Latin America, and some Asian countries.